let's talk about herpes zoster virus, better known as shingles. Now, this is pretty straightforward, but it's something that affects a lot of our patients, so we want you to know the basics. Shingles is a viral infection caused by the herpes zoster virus. Now, this virus is a sister to the varicella zoster virus, which is the chickenpox virus. So most often we see shingles in older patients who've either had chickenpox as a child or they've had the chickenpox vaccine. It can happen in younger patients, but most of the time we're seeing it people over the age of 60. Now, it's especially likely to flare up if the patient is somehow immunocompromised. So this could mean something severe like cancer treatment or AIDS, but it could also just mean that they had a UTI or they had a pneumonia or some sort of respiratory infection. And that weakened their immune system, and this varicella zoster virus reactivated as herpes zoster, and now they have shingles. Big thing to know is that it is highly, highly, highly contagious, just like chickenpox. If you've had the chickenpox and you are in contact with somebody with shingles, you can get shingles because it can activate your varicella zoster virus that's in your body. Okay, so this isn't like the chickenpox where if you've had it, you can't get it again. You can get shingles from somebody else with shingles. Okay, so keep that in mind. So the classic sign of shingles is this vesicular rash. Remember, vesicles are little lesions that are filled with fluid, okay? And they are unilateral and follow dermatomes. Now, dermatomes are nerve pathways. If you want to learn a lot more about dermatomes, check out the spinal cord injury lesson in neuro. We talked about it in detail. But basically, a dermatome is a nerve pathway that says, like this, for example, is probably about the T4 spinal nerve is where this is. So it follows this nerve pathway. So you're not going to see a couple up here and a couple over here and a couple down here like you would in chickenpox. Instead, you're going to see them all together in a line following a nerve pathway, and usually only on one side. They are very, very itchy, and they can actually be very almost painfully itchy. It can be really hard for these patients. You could also see it across the abdomen, across the leg, back of an arm, anything that follows a nerve pathway. And then patients will also have some generalized symptoms: fatigue, malaise, fever. So when we do see this type of rash with fatigue and fever, we want to immediately suspect shingles, and we want to put them in isolation right away. Now, they're always going to be in contact isolation. That's the number one thing. However, what they say is if they have a rash in 2 locations or more, so if it happens to be bilateral, they've got one on the back of their right arm and one on the left side of their abdomen, that's a diffuse rash. It's considered more advanced stage, and they will also need to be in airborne isolation because it's more advanced, okay? So we're going to assess their neuro status, their level of consciousness, and their vital signs, because shingles can actually affect the neurological system. And of course, these wounds and rash could get infected. So we want to watch for signs of infection, increased heart rate, increased temperature, etc. One of the things we can do or encourage patients to do is an oatmeal bath, just like we would for chickenpox. It can help soothe. It can help relieve some of that itching. And then we're going to give them medications. We're going to give antivirals, nonsteroidal anti-inflammatory drugs, and then know that there is a shingles vaccination. So we do encourage elderly patients who have had chickenpox to get the shingles vaccination before they get shingles. However, if they have a family member who gets shingles, we really want them to have their family get the vaccine so that nobody else contracts it either. Okay, so our top priority nursing concepts for a patient with shingles are going to be infection control and comfort. We want to keep the skin clean and dry and free from infection. We want to help relieve some of that pain and itching. Remember that virus travels along nerves, so irritated nerves are extremely painful. Make sure you check out the care plan attached to this lesson to see more detailed nursing interventions and rationales. So like I said, shingles is pretty straightforward, but let's review. Herpes zoster is an extremely contagious virus that is common in elderly patients who have had the chickenpox as a child or who received the chickenpox vaccine because it's a reactivation of that varicella zoster virus. It's a vesicular rash that has vesicles. It's painful, itchy, and follows those nerve pathways. It's usually unilateral. And so we're going to isolate them. We're going to put them in contact isolation. If they happen to have multiple areas of rash, we'll put them in airborne isolation as well. And we're going to give antivirals and NSAIDs for the pain. So those are the basics for herpes zoster or shingles. Don't miss out on all of the resources attached to this lesson. All right, guys, go out and be your best selves today. And as always, happy nursing.